Good day to each and everyone. My name is Kaye Bitoonan from BSN 1N section. Today, I will be performing and executing the donning and doffing of personal protective equipment or PPE. So before we start to execute this activity, let us first define what's the meaning of donning and doffing. So according to the FLSA, the term donning and doffing is used to refer the practice of putting on, which is the donning, and taking off, which is the term doffing, of protective gear such as clothing or uniform. So in this type of activity, there are key points that we need to remember before executing. So the first one that we need to remember is to don PPE or personal protective equipment before patient contact and generally before entering the patient's room. Once it is on, we need to use the PPE carefully to avoid contamination. So second, for doffing, remove all PPE except respirator mask at the patient's doorway or enter room. And last but not the least, remove our mask from outside the room. And last but not the least, remove mask outside the room after closing the patient's door. If hands are contaminated, then we need to stop the removal of the PPE and do the hand hygiene first or hand washing before the continuation of the removal of the personal protective gear or personal protective equipment. So since we are dealing with this type of situation or circumstance, we need to also remember the general safe work practices, and that includes first, keep your hands away from the face. Second is to work from clean to dirty. Third is to avoid touching areas in the patient's room. And last but not the least, change the personal protective equipment when torn or contaminated. So in executing the donning and doffing procedure, the very first part will always be the preparation. So in preparation, it includes the washing of hands. So we need to wash our hands in order to remove the microorganisms or pathogens present and avoid contamination. So after we have successfully washed our hands, we then now gather all the necessary equipment for this activity. So the necessary equipment for this activity includes the alcohol-based hand rub or hand sanitizer, the impermeable gown, a mask, it may be KN95 or a surgical mask, the goggles as well as the face shield, the surgical bonnet, the surgical gloves, 2 pairs, and last but not the least, the shoe cover. After we have successfully washed our hands and gather all the necessary equipment for this activity, we will now proceed to donning the personal protective equipment. So the first thing that we need to do here is to don the shoe cover. Make sure that all of the areas of the foot are covered and the shoe cover are sling over the ankle and the calf. So this is the shoe cover. Let us first start with the right foot. So again, we will start with the heel and proceed to the inside. So the same thing in the left hand or with the left hand, with the left foot, I mean. So after we successfully done this procedure, we will now proceed to the donning of the gown. So, pag properly, so in wearing the personal protective gown, we need to make sure that it will not touch the ground. Also, we need to make sure that we will only be touching the outside of the gown and not the inside. So, after we have successfully put our body inside this gown, we need to zip the zipper up to the neck, or just in line with the chest. So after donning the impermeable gown, the next thing that after successfully donning the impermeable gown, the next thing that we need to do is to don the face mask. So secure the elastic bands in the middle of the head and back, fit flexible band to the nose bridge, fit snug to the face and below the chin. So this will prevent the mask from wearing off and prevent any portal of entry for the or of the pathogen. So since I don't have the N95 type of mask, I will be utilizing instead this KN95. So again, fit the flexible band to the nose bridge. So since we are now done in donning the face mask, the next thing that we need to do is to don the eye shield or goggles. So in putting the goggles, we need to place it over our face and eyes and adjust to fit. So since our eyes is also one of the portals of entry of pathogens, we need to make sure that it is well protected. So after we successfully don our eye shield, the next thing is the donning of the surgical bonnet. So we also need to have the surgical bonnet in order to protect our head from any possible contamination. So secure also that the ear is inside this bonnet. So after we successfully done the surgical bonnet, we will now then close the hood of the impermeable gown. After we successfully close the hood of the impermeable gown, we will then proceed to donning of the face shield. So in putting on or wearing the face shield, we need to place over the face and adjust to fit. After that procedure, we will now proceed to the donning of gloves. So in donning the surgical gloves, we will need to use our dominant hand and make sure that we will not be touching the outside, only the insides of the gloves. Huwag na nito.
Satu eh. Mana? Apa nak? So this will be the final product of the donning of all of the personal protective equipment. After this, we will now proceed to the doffing of the PPE. So in doffing the shoe cover, we need to grasp the inside of the shoe cover and pull down towards the ankle, then Yeah, avoid touching the outside.
avoid it touching the outside of the shoe cover. After we successfully take off the left shoe cover, we need to discard it properly. So now we will then proceed to the right shoe cover. And dispose this properly. So after doffing the shoe cover, we will proceed to doing the hand hygiene. Ang gloves mo ito, So after successfully done the hand hygiene, we will then proceed to doffing of the face shield. And properly dispose it. After successfully doffing the face shield, we will then proceed to the doffing of impermeable gown together with the gloves that we have used. So first we need to remove the hood of the impermeable from our head and then unzip the zipper. After successfully doffing the impermeable gown, we will proceed to doing the hand hygiene. And after this, we will then proceed to the doffing of the surgical bonnet. Since we're already done with the doffing of the surgical bonnet, we will proceed to the doffing of the goggles. So we need to use the elastic band from removing it. Yeah. Discard it properly. After that, we will then proceed to the doffing of the surgical mask. So again, we will use the elastic band of the mask in removing it. And after that, dispose it properly. Since we are already successful in doffing of the mask, we will perform a hand hygiene again. So since we're already done with the doffing of the personal protective equipment, we will now proceed to the post-procedure activities, which includes the aftercare. So when we talk about aftercare, it refers to putting back all of the equipment that we have used back to their rightful places. And after putting all of the equipment back, we will proceed to washing of. Since we're already done with washing our hands, we will now proceed to the attitude of the student. So first, we need to accept constructive criticisms in order for us to be better in doing the next activity. And after that, we should also take accountability, since we should be responsible for all of our actions as a student nurse. That would be all for the donning of and doffing of the personal protective equipment. Thank you for watching.